Hello, doctor. Today I just want to bring to your attention for you to know that to practice in Canada, you don't necessarily have to always go through the CAMS route. When I say CAMS, what do I mean by that? CAMS is, the residency route where people apply for residency and then they are matched to certain programs like family medicine, like all the specialties, right? So there are there's another pathway which we call the PRA pathway, and PRA means practice ready assessment. Okay, practice ready assessment. So for today, I'm just going to give you an overview because many doctors have been asking, what are the options and which provinces do that. So I'm just going to take you through that. So we have a practice ready assessment program in British Columbia. All right, it is called PRA-BC, Practice Ready Assessment Program in British Columbia. It's called PRA-BC. If you're also planning on moving to Alberta, there's another Practice Ready Assessment Program there. It's called PRA-AB. So that is Practice Ready Assessment Alberta, right? And then Saskatchewan also has the famous SIPPA Practice Ready Assessment Program. So we've looked at British Columbia, we've looked at Alberta, we've looked at Saskatchewan. And then there's also the Practice Ready Assessment Program in Manitoba. So it's called the PRA-NB Family Practice and PRA-NB Specialty Practice. So for Manitoba, there is also the specialty route as well. So for example, if you're an internal medicine specialist, you can use that particular pathway. And then we also have the PRA Ontario, so Practice Ready Ontario, and that was introduced in 2024, right? So that's great. And then in Quebec as well, we have the Collège de Médecins du Québec, CMQ. So that is Practice Ready Assessment for Quebec. So if you have a strong background in French as well, you can look at that particular Practice Ready Assessment pathway. And then New Brunswick as well, we have the Practice Ready Assessment New Brunswick. And for Nova Scotia, we have the Nova Scotia Practice Ready Assessment Program, which is the NSPRAP. And we also have Nova Scotia Physician Assessment Center for Excellence. That is PACE. So that is something Nova Scotia has also set up to help absorb doctors in there. And then we also have Practice Ready Assessment for Newfoundland and Labrador. So for today, I'm just drawing your attention to the fact that whichever province you find yourself in Canada, there's a Practice Ready Assessment program there, and you can, based on their requirements, just check your training and make sure that you fit into that particular Practice Ready Assessment program. In the coming days and weeks and months, I'll be sharing snippets on what the various qualifications are and what you can do to make sure that you get into these individual Practice Ready assessments. And the goal is, ask yourself, what is your background? Do you want to go through the specialty route? Do you want to go through the family medicine route? And whichever background you want to get into, which province do you want to go into? Some of the requirements of the various provinces differ a bit. Some of the requirements also cut across some of the provinces. So look, take advantage of this time. Make sure that if you have that prerequisite, you get in and you do it. So I'll be here. As usual, I'm your friend, Dr. Brony from Cognito. Let's get in there and let's get the best out of these Practice Ready Assessment routes. All the best.